myself first. My name is Dr. Rizzy Alejandro from AC Health. So I handle the communications team for AC Health. Thank you so much for joining us on our Saturday. Alam kong Saturday po ngayon and dapat nag-relax po kayo. So we appreciate you coming out here. Very quickly before we begin, I'd just like to introduce our panel for this morning. So we have with us this morning our CEO for AC Health, Mr. Paulo Borromeo. So Paulo is also concurrently a managing director at Ayala Corporation, where he heads the strategy team as well. We also have with us Mr. Jay Ferrer, who is the VP of Operations for Generica Drugstore. And we have Mr. Paul De Roca, who's the General Manager for Family Doc. And lastly, Mr. Jerome Uy, the CEO and the founder of MedGrocer. So I think I'll very quickly turn it over to Mikey and Jensen from FC to just do a quick run through of our guests for this morning, just so the rest of us know who's present in the room.
Good morning. We would also like to introduce our media friends. Thank you for joining us. We have Jude Austria of TV5, Joey Baluyot of TV5, Nonoy Laksa of Business Mirror, Erwin Monroe of DWWW, Jan Sino Cruz of Remate, Larissa Garcia of ASTIG.PH, Sheikh Sis Cross of PSST.PH, Erwin Temperamente of Net25, Dennis Hernandez, Ruel Luntosa of Net25, Manny Palmero of Manila Standard, Annie Mogato of Business World, Annalie Labor of Daily Tribune, Boy Santos of Philippine Star, and Mike Taboy of Abante. Welcome.
Welcome, thank you so much, and thank you to Mikey as well. So the format for this morning will actually be a little bit more casual. What we'll do is we'll have a guided panel discussion with our panelists here this morning. Then we have a Q&A portion afterwards. So feel free to reserve your questions for the latter portion. So to start out, I guess, we're very happy to, of course, I guess, come back to the media and reiterate that Ayala is now in healthcare. So I think a lot of people are still surprised to find out that Ayala is now in healthcare. But we started 2 years ago in 2015. So Paolo, can you tell us a little bit more about why Ayala decided to go into healthcare?
Can I get that one? Very good. Thank you, Rizzy, and thank you everyone for being here. A lot of new faces for me, but certainly very recognized organization. So thank you for attending. First of all, today is a joint event in partnership with the Asian Institute of Management and the Pharmaceutical and Healthcare Association of the Philippines. And this is our, I guess, contribution and collaboration with them to be able to highlight what we do at AC Health and at Ayala. But also for us to be able to share with them some ideas for the industry and some, I guess, thoughts on how we together can work both across the private sector and the public sector to improve healthcare delivery and outcomes here in the Philippines. Which brings me to, I guess, your question, Rizzy, why is Ayala in healthcare? I think for us, it's a recognition that our Filipino citizens need better access to quality healthcare in general. 3 or 4 years ago, when we started looking at this industry, we said across the value chain or across the life of a Filipino, there are so many healthcare issues and problems, and it was unfortunate and actually very sad when you think about the statistics. And a research team showed us that from birth to death, it felt like a very unfortunate place to live in, and it shouldn't be that way. And we think that we can help improve the Philippine healthcare ecosystem in collaboration, of course, with the government and with other private sector participants. So that was really it. And so we said 2 or 3 years ago, we would like to participate, invest in the healthcare sector in a modest way. We thought, for instance, that it could Certainly, our township developments through Ayala Land would be able to help put together or put up hospitals, and we've since partnered with a group called QualiMed to put up hospitals in 3 township developments of Ayala Land. After that, we said there's a lot more work to be done in terms of affordable medicine and affordable healthcare. And so we partnered with Jay and his family at Generica in 2015, and I'll let Jay explain that more. But the idea is, how can we help promote generic medicine in the Philippines when still many times pharmaceutical products here in the country are 30 times more expensive than other countries. So, and then after our partnership with Jay, we started our own venture into what we call primary care retail clinics, which we call Family Doc. I'll let Paul Daroca explain that more, but the intent there is to be able to serve more people, bring healthcare to the barangays, and bring primary care and primary care doctors closer to many of our kababayan. And then finally, we partnered with Jerome, who founded a company called MedGrocer, which is an online pharmacy. But it's more than just an online pharmacy. It provides pharmacy benefits, pharmacy analytics, and a lot more services. I'll let Jerome explain that. But I think you can see now, based on our 3 partnerships here with me at the table, is the objective and the desire is to bring more affordable care closer to people and more convenience and easier access to that kind of care to many more Filipinos. So whether it's through affordable medicine, whether it's through affordable primary care, or whether it's through convenient online ordering, the idea is sana we can help our fellow Filipinos get the healthcare that they deserve. I'll let you take.
Okay, thanks, Paolo. And you talked about the current AC Health family. So we have Generic and Family Doc. I think we mentioned that there's a strategy towards retail health. Can you talk a little bit about that, Paolo, and maybe the future strategy as well for AC Health?
Yes, I think when we say retail health, it's really consumer healthcare, and so bringing accessible care to the different communities and the different barangays around the country. There's a lot more room for growth when we think about the network, for instance, that we're building at Generica, and the network that we're building at Family Doc. And what we can't reach, certainly MedGrocer can reach. And so for Generica, we're looking forward to building a lot more pharmacies. I'll let Jay explain that more. With Family Doc, at the same time, we have a massive expansion program, which I'll let Paul explain as well. And Jerome, I'll let you explain your expansion plans. I guess beyond retail health, what we're trying to do at Ayala is establish a healthcare ecosystem. So that when you have more pharmacies, kayang-kaya na maabot ang mas murang gamot, and then you have more primary care clinics, you're starting to see an ecosystem. A favorite word namin at Ayala Health. It's a healthcare ecosystem. It's an integrated healthcare ecosystem that then allows different touch points for the patient. So kahit anong sakit mo, whether it's just a cough and a cold or something more serious, that we could provide you access to different kinds of touch points. Whether it's a pharmacy, whether it's a primary care clinic, or whether it's a hospital. And so for us, that's important. And as we're trying to build this ecosystem, I guess I'll say also that we're looking for more partnerships and more investments. We're looking at the hospital space and trying to identify ways to grow that segment. We have a partnership with QualiMed, but when you look at total beds to population ratios in the Philippines, where it should be 3 beds to 1,000 people, we still have a massive shortage of hospital beds, no? And so we'd like to build more hospitals, partner with other hospital groups to develop an integrated healthcare ecosystem. We're also looking at partnerships with financing institutions and other healthcare technology organizations because we think it's important that any ecosystem is unified or connected by both financing and technology.
Okay, thank you, Paolo. I'll go to Jay now. And Jay, the partnership with Generica started in July of 2015. How has Generica grown since the partnership with AC Health?
Well, ever since AC Health came in, the targets really for growth were much higher. So from that time, we were roughly, I believe, around 500 stores then. Now we're already at a little over 700 stores today and still growing. And by the year 2020, we should hit more than 1,000 stores. So that's how aggressively the partnership with Ayala has been able to help in the growth of Generica and increasing its network to cover most of the Philippines. I guess my father would, at the onset, really wanted to cover even the remote areas of the Philippines, if possible. So we're really looking at doing that. And then, basically, it also helped us to address the need for the Filipinos. We wanted to cover that gap in terms of access to medicines, specifically affordable quality, affordable generic medicines. Because then, when it started off, the main issue was how are we sure that the medicines that are available in the market, the generic medicines, are of quality. During the early stages, there was really a big media hype on fake medicines, medicines that are not supposed to be effective, especially those coming from a certain country. You know? So that was really the problem then. Okay, and what we wanted to do was be able to offer that and then give it at a value wherein most of the consumers would be able to sell. So the savings that you can generate from buying generic medicine from Generica can go as high as 85%. Okay, so but of course it ranges depending on the kind of medicine you're buying, but it can go as high as that. And then just recently, in last September 23rd specifically, as part of the 14th year anniversary of Generica, to give back to the community, we had our first simultaneous nationwide LK, or our Libreng Consulta, which is something that we feel that we own and something that we more or less made a part of the service that a drugstore should have. Because this is addressing the basic need of most Filipinos where they can't afford consultation fees. Magkano ngayon kung magpakonsulta? 300, 500, or even more depending on the kind of doctor. At marami sa mga Pilipino, there are a lot of Filipinos around, especially the less privileged, mas gusto nila or they would rather put that money into the medicines than to pay for the doctors. So during the time we realized na this is one way we can help further by doing this. And then during our anniversary, we're actually able to do it in roughly around a little over 380 stores. And for that day alone, we were able to give that Libreng Consulta service to more than 20,000 people in the Philippines. So that was already something for us, a good way of at least giving back and sharing over the years.
Jay, you mentioned serving the people and giving back and sharing. And I think some of you might know that Generica was recently awarded in the ASEAN Business Awards in the Inclusive Business category. So we were actually the first recipient of that award. Jay, can you talk a little bit more about this inclusive business model and your philosophy at Generica?
Yeah, I guess at the onset, when Generica was established, the main thrust there was basically public service and then helping the community. Okay, so that was the main reason why my father, Ted Ferrer, and his previous partner then, Julian Bello, decided to put up Generica. So basically, they were answering the needs for the regular Filipino people. Na most of them, they realized that when they were buying medicines, they were buying the branded medicines. They were going out to buy the branded medicines. of which, especially if you're talking of antibiotics, they could only buy so much and hindi natutuloy yung treatment. Okay, so because of that, they thought na, why don't we put up something that hopefully will be able to give back, give these people an option, a better option, something that they can afford and yet maintain their health. Okay, make sure that they will be cured of whatever sicknesses they may have, and eventually have better lives and better health, and give more benefits then to their family. So that was why we did that. But obviously, when we were expanding, my dad and his partner then had limitations on funds. So how would we felt that one way to be able to help also is teach people how to be entrepreneurs. That's what my dad was. And after working for so long, when he retired, that's when he realized he wanted to be an entrepreneur and start up a business. So I think it became an inspiration also for some people. Now you can be an entrepreneur at any age, and then you can actually still run a business at any age. And with this, you're allowing now people to be able to contribute more to their communities. In fact, we've had a lot of franchisees that grown their businesses because they've been able to help their community so much more with the franchise that they've purchased. And then they've expanded to other communities, and now they're giving the quality, affordable medicines that we wanted to start off to offer now to the communities where they are. So the franchising model helped to generate more business, more jobs in these areas. It also helped to create more business in this new community. So at the onset, it was really more towards building up communities and helping the people in those communities that we would open our drugstores.
Okay, and Jay, I think one of the new taglines of Generica is laging may plus ka dito, and the gabay philosophy, and I think that's something that's very evident in the things that you've discussed. Any new innovations from Generica, Jay? What can we expect from Generica?
Well, yeah, going back to the gabay, it's basically something that we're really into, offering guided service to our communities. Now, we're not just here selling medicines, but we're here to watch over your healthcare and make sure you're basically healthier and living happier lives. Now, moving forward, we've also looked at other means by which we could maybe answer the needs of the communities, and part of it is in more services and even more products that we could offer. So we're piloting a new store concept in Taguig, Signal Village in Taguig, which is the first in the Generica model of stores, because our stores before were basically behind the counter. This is the first store where we're going to have a self-service area offering wellness products or more related to health, having better health or preventive care. And then meron na rin pong mga consumer goods, personal care products to address the need, because I think the growing need now is more for convenience. More people are looking for convenience. Of course, another thing that's new is I believe we were the first in the Philippines to offer the Gamot Guide. What's the Gamot Guide? It's a Gamot Guide is actually a simple version of your prescription. In layman's terms, kino-convert namin kung ano sa prescription to layman's terms para mas madaling maintindihan ng tao. Most of the, as Jerome mentioned earlier, most of the doctors have the best penmanship. Okay, it's kind of difficult to understand. So if you're a patient, mahirap yun. But the Gamot Guide is printed in such a way na mas madali siya maintindihan. And we're trying to do it also in different languages. If we have to do it in a dialect, we try to convert it to the dialect para mas madali pong maintindihan. And doon, ang simple guide is to how do you drink the medicine, how often do you drink the medicine, and simple indications dun gamot pag ininom mo siya. So, malaking tulong. And when we started to offer that, nakikita namin yung, lalo na mga senior citizen, tuwang-tuwa sila. Kasi at least, maalala pa nila kung paano nila iinumin yung gamot. At ano yung kailangan nilang sundin. And obviously, nandiyan na rin yung Med Padala, which is a product that's meant to cater to the needs of our OFWs din, na assurance na yung perang pinapadala po sa Manila is magagamit para sa gamot. at dun lang siya. Okay, and meron din pong yung masasabi namin yung family health card, which also caters to the needs of families, communities. Kasi hindi lang siya magagamit para sa pagbili ng gamot, magagamit din siya for consultative services. Of course, partnered with our diagnostic partners there, one of which is Family Doc. Okay, so these are all of the products. And marami pa, because I think in generic what we're trying to do is we're trying to offer convenience in terms of managing your health as well, so that you can be healthier in your lives moving forward.
Okay, thank you, Jay. I'll turn it over to Paul now. Paul, Jay already mentioned that there's a partnership with Family Doc and Generica. Maybe before we get into that, could you tell us a little bit more about Family Doc and what services we offer?
Okay, so basically Family Doc was conceptualized because we saw there was a need, no, in terms of accessible and affordable quality primary care. And when we talk about primary care, it came to the point that it became non-existent. I was telling in one of the conferences I did, I was telling a story about, my dad, when they got sick when they were young, there will be doctors within the community that would actually go to your house. Diba? Maybe your lolo or your or some of your relatives, that they would tell you stories na may pupuntang doktor. And then in our case, when I was young, there would still be clinics around the community. So hindi na nakapunta yung doktor sa bahay, pero basically, tayo na pumupunta sa doktor, but hindi malayo. Now, my kids, and kanina nga, during the talk of Consulta MD earlier, sinasabi nga na for a young parent, mahirap ngayon magkasakit yung mga anak. Kasi parang ikaw din nagkakasakit at kailangan mo pa mag-leave. Kasi alam mo na kailangan ka maghanap ng espesyalista, kailangan pumunta ng ER, pipila ka, at sometimes pag pumunta ka, wala pang doktor. So nakikita natin that this is prevalent now, and there's a big gap. So one of the statistics that we saw early on was that 40% of the patient of our Filipino either family do not get to see a doctor in a year. 80% of cases at ER are not actually ER cases. These are your typical primary care, ubo, sipon, sakit ng ulo, sakit ng tiyan. And the sad story is that they have to pay extra when they go to ER because ER would charge you probably 3 to 5 times more than what a primary care facility would actually do. Thirdly, as I mentioned, basically yung accessibility to doctors is a big problem. No? While there are a lot of doctors, walang malapit within the community. Number two, kung meron man, nakaschedule. I don't know if you have experience, the doctor is only here from Monday to Wednesday. Diba? From 2 to 5 o'clock. Typical story. And pag pumunta ka ng 2 to 5, swerte na kung pang number 30 ka. So sobrang haba ng pila. So this is where Family Doc comes in and try to address this need. So Family Doc is basically a 3-in-1. So what we did was to make the clinic so convenient for the patient. So it's really patient-centric when we design the Family Doc clinics. Number one, laging may doktor. Monday to Saturday, 8 a.m. to 8 p.m., may doktor tayo. Number two, pagkatapos mo magpa-doktor, dalawa lang naman sasabihin ng doktor sa'yo, magpa-labs ka or bumili ka ng gamot. In Family Doc, pwede ka magpa-labs, pwede ka bumili ng gamot. May sakit ka na nga, hindi pa sasabihin ng doktor, pumunta ka sa kabilang kanto, o sumakay ka pa ng dalawang rides para makabili ng gamot, or pumunta ka dun sa diagnostic center, kasi doon ka magpapalabs. Dito, all-in-one. So in one roof, you have a 3-in-1 format whereby it gives you the total convenience and total care for the patient. Meron tayong konsulta, meron tayong pharmacy, meron tayong diagnostics. And we made it very accessible such that we built the clinics dito sa mga community. So we identify, when we start to open Family Doc clinics, we identify where are the large communities, where are the large subdivisions. And many people ask me, the first thing they ask, saan kayo nagbukas? So sabi ko sa Cavite. And the second question they ask, why Cavite? And we said that Cavite is one of the biggest province with 3 million. And it's very sad because our public health facility or even the barangay health centers do not have doctors. And these are big communities. And we were also surprised that even families in Bacoor would even have their checkup in PGH. Ganun kalalayo yung kanilang kailangan i-travel just to get a good care. No? So we made it affordable, accessible, and we made sure that also we have standards of quality in terms of primary care.
Paul, you mentioned Cavite. Where are the other sites of Family Doc? And I know we're on expansion mode right now. Can you talk about how many sites we have and our plans for expansion?
Okay, so currently, we started in 2015 with 2 pilot clinics in Cavite and in Las Piñas. So we really targeted the south area, suburban area. We are now, by the end of October, we will be at 15 clinics. This covers Imus, Dasmariñas, Bacoor, and we have clinics also in Las Piñas, Parañaque, and recently in Pateros. So soon, we will be also opening in the areas of Taguig and Pasig for this year. By end of the year, we will be a total of 24 clinics. And we're looking at opening 50 clinics by next year. This covers you from Cavite up to Quezon City. And by 2020, our target is to hit 100 clinics. Of course, we also feel like it's in the same way with Generica, we would like also to get partners to open our clinics. And we're now studying the option for franchising. So soon, by next year, hopefully we will launch also our franchising to open more clinics to other communities. Kasi kung makikita niyo yung 100 clinics, probably that will only reach up to Bulacan area. And as early as now, we got a lot of inquiries even as far as Mindanao from the north, no, that inquiring about franchising because nakikita nga nila yung that this can actually help the community and offer primary care services, quality and affordable.
Okay, Paul, and with that expansion, you were looking at 24 by the end of this year and then 50 by the end of 2018. What measures have we put in place to make sure that, of course, we're still getting the same quality care throughout the clinic network?
So basically, currently with the 15 clinics that we will have, by last September 30, we already hit the 40,000 patients. No, these are unique patients. So which means when you go to Family Doc, you register, and there are actually a lot of returnees already. So in terms of consults, this is probably times 4 in terms of number of consults. But total number of members were already 40,000, and we would like to be consistent in terms of our care, and that's our promise to the community. So we have actually hired 66. Medical team to man all of our 15 clinics. We have 36 doctors currently. And to ensure in terms of quality, we also be part of the residency program. So all of our doctors are also residents of family medicine. So after 3 years, they will be also family medicine specialists. And every week, they actually have lectures. We also help our doctors with technology. So one of the things that we have in Family Doc is our electronic medical records, or EMR. We have developed that under AC Health. Basically, one is to ensure that we are able to track each and every patient, what we have done for them. Number 2, it's also predictive, which means that if a patient comes in and does their vitals, the EMR can actually also show you what are the risks involved. So let's say, kung ito medyo 40 years old, overweight, no, and may mga nagsusmoke, probably lalabas na immediately sa EMR that high risk for hypertension or let's say diabetes, for example. It's also cloud-based, which means that all our clinics are linked. So let's say if you went to if you're a resident of let's say Pasig, and it happens that you go to Cavite and you don't feel well and you want to go to a Family Doc clinic, you can go there and immediately you can see the doctor there sees your past records. So we're all integrated into one system.
Okay, thank you, Paul. And you mentioned technology, so I'll turn it over to Jerome now. Jerome, MedGrocer, online pharmacy, how are we using technology to sort of change the landscape of retail pharmacies here in the Philippines?
Thank you for the question. MedGrocer is an e-pharmacy that delivers. So what we do is our online platform allows us to eliminate all the inefficiencies and assumptions of the traditional drugstore experience. So let's say saving on rent, saving on labor, tracking people's prescriptions and medicine purchases from before. We can all do that right now through technology, and we can also take orders, for example, through an online platform. Yeah. We basically serve two kinds of customers. The first ones are the consumers. So basically, people who are sick or who have or who are caring for sick people can order anytime, anywhere, and have their medicines delivered to them. We also serve companies. So a lot of our customers right now are actually companies, and we handle, for example, their clinic supplies and medicines. We handle their vaccinations. We can analyze their healthcare spend as a whole, and we also provide ways where it's easier for their employees to manage their sickness with maintenance meds and things like that, where we can actually track and take care and make sure they adhere to their medicine regimen.
Okay, and Jerome, I think when we announced that AC Health was investing into MedGrocer, quite a few people were surprised because MedGrocer is a startup, and people think that it's unusual for Ayala as a large conglomerate to invest in a startup. How has the Ayala Group AC Health helped MedGrocer with its growth over the past year?
Ayala may be an old conglomerate, but we've never met a group of businesses or a large company as forward-thinking with health. So Ayala's been an amazing partner in terms of piloting many of our programs. So the first thing we do normally is to talk to Ayala and see, as a company, would you buy this product? How would you change this service? And it's nice to have somebody who you can trust and who trusts you. So a lot of the piloting and the feedback initially comes from Ayala. Second thing is the reputation. If it's good enough for Ayala, pretty much every other company thinks it's good enough for them. And of course, we have a duty to protect that reputation as an Ayala member company, and that makes us bring up our game to our next level. We don't just carry our name, we carry the name of a very respected business. And the third thing, obviously, is being part of a bigger family in terms of marketing, HR, medical advice and support, and so on and so forth. It's nice to be able to draw from this group the scale and resources that they have.
Okay, thank you, Jerome. Paolo, maybe you can talk a little bit about the health technology strategy of AC Health. We started with MedGrocer, but what's next for AC Health in terms of health technology?
Thank you, Lizzie. I think in terms of healthcare technology, we at Ayala recognize that to deliver more affordable and more accessible care, you need to utilize new applications, new ways of doing things, and there are many innovations in healthcare that we can introduce into the country that can drastically improve the quality of the care that's provided. So, MedGrocer is a perfect example. Another example is we invested, actually, what Paul was saying earlier, in the EMR technology, the electronics medical record technology within Family Doc. We are exploring ways to commercialize that technology and provide it to other clinics and hospitals. And so we there's a whole range of technology and trends in healthcare that we are looking at, and hopefully, like with Jerome, we're looking to partner with other enterprising budding entrepreneurs who have excellent ideas that they want to implement. I just wanted to comment also, Rizzy, on what Jerome said about Ayala, the Ayala Group and healthcare. And as I mentioned at the very start, this is an important industry for us as a group. Our chairman has repeatedly said healthcare is an important agenda for the Philippines moving forward, as does the Philippine government, and the Philippine government recognizes that as well. No? But for us within the group, just to highlight beyond what Jerome's saying, we work very closely with our group companies. So Generica, for instance, is the exclusive partner at Globe Telecom. So Generica supplies all our Globe employees their medicine benefits. Family Doc has partnered with Integrated Microelectronics, which is our electronics manufacturing company, but we have factories in Laguna Techno Park, which is very close to where our clinics are in the south, and a lot of them live in the southern area. So Paul has partnered with IMI to come up with what we call family health cards that we then provide our employees so that they can get unlimited consults for their family in our family doc clinic. So there are a lot of synergies within the Ayala group, obviously, that AC Health is able to leverage and explore.
And Paolo, you talked about synergies across the Ayala group, but within AC Health, we also have synergies, and one project that we will launch in November is actually a Family Doc Express. So maybe Paul, back to you, and Jay a little bit to talk about that Family Doc Express format.
Yeah, so we recognize that one of the things, and that's why the Libre Consulta was launched by Generica, because actually people, when they go to the drugstore, sometimes they would like to ask for antibiotics but they don't have prescription. So sometimes nabasa na sa Google or narinig nila sa kapitbahay. So, but we would like to address, and we'd like to make it closer to you. And a synergy, we would like to come up with a project which we call the Family Doc Express, which is a joint project of Generica and Family Doc, whereby we will provide doctors inside a Generica store. We will have the laboratory, and when you need your medicine, you go to the Generica counter. So it's a all-in-one concept, and we would like also to make sure that we don't only serve in terms from the south to Quezon City, but also expand our reach through the Generica stores. I'll ask you to add.
Yeah, I guess kasi there are also instances where Generica would end up with spaces that are relatively large for our size, and then it's not fully maximized. And normally we would approach local doctors, local practitioners, and offer the areas for clinics. So this is a good opportunity for us to work together better, to have that synergy within the group better, so that at least now we're assured that the partners we have in our rented spaces have the capability of offering the quality service similar to what we're also offering, because we know that these are our family doc partners.
Okay, thank you, Paul and Jay. And maybe just to end our roundtable discussion of very exciting things for AC Health. I think we're all excited about the expansion. The healthcare space is growing. It's also very competitive. And I guess my last question for Paolo is, AC Health as a new player, how do we plan to distinguish ourselves here as we enter the healthcare space?
Yeah, thank you, Rizzy, and again, thank you to everybody. I guess if there's one message I wanted to emphasize is our focus at Ayala is to build a healthcare portfolio that is very retail-oriented and consumer-focused. So our mantra is always patient first. So kung anong kailangan ng pasyente. And our strategy is what we call retail health. Meaning first point of contact with the patient, whether it's a pharmacy, whether it's an online application, or whether it's our primary care clinics, and then of course the hospitals. But it's a very retail health oriented strategy. And as with any retail health business, what's important there is that you are able to integrate across the different points of care, and you do that through technology, through systems, and as I mentioned earlier, through financing opportunities as well. No? So it's very important that you're able to connect the different assets. But I hope that's clear, because it's very retail health facing. It's retail health oriented, very consumer facing, and patient first. And behind all of that, our basic principles are innovation, technology, to bring down affordability or to improve affordability and to improve access. So we will not be shy to invest in technology, initiatives, startups, and other efforts to improve affordability and access. Siguro my last message lang is maybe more towards encouraging different stakeholders. So number one, if you're a healthcare practitioner, if you're a doctor, if you're a pharmacist, if you're a nurse, if you're a rad tech, you can work with us. You can join us, and there you can help us, as we say, redefine healthcare. We're looking for very bright, energetic healthcare professionals, being a doctor, nurse, pharmacist, and rad techs, to join our team, no? Whether it's a grocer, generica, or family doc, respectively. Number two, if you're an entrepreneur, whether you're parang nagsa-startup ng kumpanya, whether it's technology or whether it's some new concept, we'd love to hear from you. We'd love to get ideas. Or if you're an entrepreneur that's wanting to franchise, we're looking at more franchisees, both for Generica and, as Paul mentioned, eventually for Family Doc as well. No? So I guess it's a call out to both healthcare practitioners and entrepreneurs, those who share our vision of bringing better care and more affordable care closer to Filipinos. Please join us, and we hope we can work together.
Thank you very much. We'll open the floor for questions.